look at the different types of research questions, because many a times the queries which we ask from you all, the queries are regarding research question, how to identify research questions, and what are the different ways you can refine your research question. Then, of course, we are going to look at what are the various study variables and how to identify those variables, what actually is confounding, and how you can handle confounding in your design and also in your analysis phase. This I'm not going to go in great details, but just give you an example. And then the example, the research question which we are dealing with, the ethical issues for such research questions, and the results of the analysis which is done, and how, in short, to write discussion for such a research question. So again, like last time, because I feel the crux of any research is the research question, identifying the correct research question. So we have to ask ourselves whether the answers to our research questions are going to fill any knowledge gap. Are they going to modify or have an impact on clinical practice or on public policy or any program initiative? So if directly or indirectly our research and the answer to our research question does any of this, then I feel that on track. Now, there are different types of research questions. I'm just showing you these types because the type of study design and your decision of the way you want to answer the research question depends upon, like many other things, the research question per se. So there could be a descriptive research question where you will use a descriptive study where you just want to describe the disease in terms of either person, place, time, or all of the three. Or it could be an analytical research question where you have identified specifically the exposure and the outcome, or the independent and the dependent variable, and you are just trying to understand the association between two specific variables. It could be an experimental research question where you want to see the effect of the interventions. Then you have the prognostic type of research questions where you want to see the prognosis of the disease over a period of time. It could be a diagnostic or a screening test research question where you want to assess the validity of a diagnostic or a screening test. Or you want to look at the screening research questions, whether you want to see the impact of the screening program per se on the health outcomes. And lastly, the operational or the implementation research, where you want to find out the barriers and facilitators for interventions in a program, or find out the best possible way for implementing the interventions in a program. So when you frame your research question, automatically there are some preferred research designs which should come in your mind. Again, repeating what we did last time, from where do the research questions come? So it comes from literature, the articles you are reading. Those, while reading, you find that there are gaps or some work needs to be done. So the research question pops up. You can have discussions with experts in a particular field in which you want to do research. That can help you frame your research questions. Then your own experience, you are doing some work and your own experience in the field or in your daily routine. So there are queries which arise in your mind, and that is the origin of a research question. There are call for proposals on the websites of different national, international programs, international agencies. So you can look out for these calls and identify what matches your passion and write your proposals by framing an appropriate research question. And then, of course, each program has its own research priorities. So those are also mentioned by the government on their website, and you can go through those research priorities and identify what interests you. And again, I am harping on this important point that avoid Me Too studies, because many times students come and when we ask them about their research question, their topic of interest, they just narrate the title of some article which they have found during their search. Now, such articles are going to lead to Me Too studies and not going to add in any way to the three dimensions which I told you at the beginning. And therefore, as far as possible, we should avoid replicating studies which have been done multiple times. So today what we are going to do is we are going to look at a specific research question which we try to handle in our electives, the undergraduate elective sessions. So we had two students and we were looking out for research question. The elective was scientific manuscript writing, and Dr. Prashant Huar, associate professor from our department, had already really in our discussion was mentioning this question which was in his mind. It was about air pollution and emergency department visits for acute respiratory illness. So I think we have Dr. Prashant Thowal with us. So basically, he was, or he is rather, a nodal officer for reporting the acute respiratory illness cases which report to the emergency department at JJ Hospital. And I would really like to invite him to tell us about his role and how this particular research question arose in his mind. Dr. Howard, are you here?
Yes, ma'am. Good evening, all.
Yes, sir.
Thank you, ma'am, for giving me the opportunity to share my experience regarding this work. Basically, I was made the nodal officer for this program, and the name of the program was National Program on Climate Change and Human Health. And under this program, Grant Government Medical College and JJ Hospital was made as a sentinel surveillance site for reporting of the cases. So what used to happen that on a monthly basis, as a nodal officer, I used to liaise with the three departments in our hospital, mainly the medicine, pediatrics, and the chest TB department. And the reporting formats were shared with those three departments. Training PPT was also shared with the departments, and they were given a fair enough idea of what will be the inclusions and the exclusion criteria when they report the counts of the cases related to acute respiratory diseases, which they see in the emergency visits. So we had a mechanism of a common Google Sheet, and then on a daily basis, the respective departments used to enter the data. And then at the end of the month, we used to compile the data into the reporting formats, which were mainly annexure A, B, C, and D. There were 4 annexures, which we used to fill and report it to the state in Pune, and remaining, and as well as we used to keep them in the loop with the National Center for Disease Control, New Delhi. So this is how the data was started. I came into the picture from 1st of November 2019. And since then, we used to maintain the record of the data in the soft copy as well as the hard copies. And when, as ma'am mentioned, when we wanted to think of the possibility of preparing a research paper, so we had a secondary data with us for last 3 years. So from the year 2020 to 2023. And based on the data, we actually wanted to understand what was the association between the air quality and the emergency department visits in our hospital setup. And accordingly, we analyzed the data for those 3 years, and we got a good insights into the from the data, and this is how it was. This is how the curiosity to understand what is the association between the air AQI and the patient visits, and as we already had the data with us, we thought of carrying out a research paper.
Great. Thank you, sir. The word curiosity, which sir mentioned, I think is very important. So he was doing a job and it was his routine work, but somewhere in his mind, he had a question that whatever numbers he is reporting, how is that really affected by the air quality? And that is why I think the word curiosity is important. Keep your eyes, ears open and keep thinking, and you will get interesting research questions. Thank you very much, Dr. Prashant Huar.
Welcome.
So now next what we did once we knew that this is what we are trying to answer is so again this is actually what kind of a research question. This was a question for you all, but anyways, so because why do you think this is an analytical research question? Anyone from the audience? Because I told you there are different types of research questions. So why do you think this is an analytical research question?
Good evening, ma'am.
Yeah, good
Yes.
evening.
So we are trying to find the association between these two, ma'am. That's why,
Right.
like air pollution and the number of ARI cases. That's
Correct.
why it's called analytical research question. Yes.
Correct.
Thank you.
Right. So there are two variables and we want to see the association between two variables. So it is an analytical research question. So Dr. Howar has already mentioned in detail about the context in which this particular research question arose. So I'm not going to again repeat it, but in summary, the department was already collecting data and reporting the number of cases of acute respiratory illness under a program, and this was being done by the clinical experts in three different departments, the clinicians in three different departments who were reporting to the nodal officer of the hospital, who in turn was reporting the numbers to the district, then the state, and then the data went to the national nodal officers where all the data was accumulated and the report, annual report was published. So that was the flow of the data. So this was about actually the number of acute respiratory illness cases reporting to the emergency department of our hospital. So this is how the reporting was done. So we had three departments and they were reporting. There were different headings under which the reporting was supposed to be done, the details of which I will show later on. But there was an app on which the reporting was or is being done, because it's also currently being done by the departments. So the research question was, is there any association between air pollution and patients with acute respiratory illness presenting to the emergency department? Again, what I want to show is that as we look at the data, as we read literature, the research question, we keep refining the research question and retuning the wordings which are there in the research question. So as Siva mentioned, we are interested in two variables, the outcome variables and the exposure variables. So what are the outcome variables here? The outcome variables, if anyone can, again, because Siva has already said, but let's just be clear about which is which variable.
Acute respiratory illness.
Sorry?
Acute respiratory illness.
Is the right
Outcome.
Yes. So Ashwini says that acute respiratory illness is the outcome variable and the air pollution or the air quality is the exposure variable. Now, actually, when we look at the data, there are some specific headings under which the acute respiratory illness is reported. So it is in terms of the daily total number of patients visiting the emergency department in these three specialities, the total number of patients diagnosed with ARI in the emergency department, the total number of patients receiving nebulization in the emergency department, requiring hospital admissions in the emergency department, and then requiring non-invasive, and there is a sixth one, requiring invasive ventilation in the emergency department. There are 6 different headings outcome. for which data is reported, and these are daily number of cases who are visiting or who are requiring different interventions for management of acute respiratory illness. So what we have to do actually is, once we know what is the outcome, what is the exposure variable, we have to further go and see what is it in the outcome variable that we can collect, what is the feasibility, what is available, what can be done about with respect to the outcome variable. Now, as far as the exposure, so we had data for the outcome variable, but what about the exposure variable? So the program was not really collecting data, or the nodal officers was not collecting or reporting about the exposure, that is air pollution or air quality. So we had to look at some other resource to get data on the exposure variable. So this data was obtained from the Central Pollution Control Board, the website of the board. So the air pollution is measured using the air quality index. So there are different air pollutants, the levels of which are measured, and the 24-hour average concentration is used for coming up with the air quality index. So that there is a formula, and there are different set protocols for calculating air quality index, the values of which can range from 0 to 500. Now here what I'm trying to tell you is, you should know what your outcome variable is, what your exposure variable is, and then from where are you going to get the data, and what will be actually the variable. How are you going to define the variable? So we have now an index which is going to help us measure the air pollution, and this we are going to get from the website of the Central Pollution Control Board. So there is some clarity on the exposure variable. Now when we look at this data now for exposure, and then we try to look at our research question, our research question becomes, for 1 unit increase in the air quality index, what is the change in the number of cases presenting to the emergency department? Now we have to ask ourselves, are we interested in this research question? What is the utility of this research question? So when I look at this research question, I feel that, okay, answering this research question can draw attention for climate change. That is, a unit increase causes so much increase in the number of cases coming to the emergency department. But for the hospital or for the care providers, this does not hold much value, because we hardly look at unit increase, or what is a unit increase or change in the air quality index. So we have to really look at the exposure in more details to refine our research question. So if we look at the website again, this air quality, the indices are classified into different categories. There are the set cutoffs for categorizing the air quality index into good, satisfactory, moderate, poor, very poor, and severe AQI category. So we now look at these categories. We say, okay, we will not look at 1 unit change in AQI. We will look at change in the number of cases coming to the emergency department as the AQI category changes. So it will be easier, even the clinicians or somebody can look up and see what is the category which is there, and we can have a rough idea about the cases which one would expect to have occur on that particular day. So the research question now is with regards to the categories and not 1 unit change. So the question becomes, does the number of ARI cases presenting to the emergency department differ according to AQI categories, or is the number of ARI cases presenting to the emergency department associated with AQI categories? So your research question can have different wordings, and you can refine it until you are satisfied with your research question, because that is the crux of your research. So you can go on refining your research question, and it could be something like, what is the risk of patients presenting with acute respiratory illness to the emergency department of a tertiary care hospital in a metropolitan setting during births or the degraded AQI categories compared to a good AQI category? So that could be your final research question. So as you read, as you look at the variables and the data you have, especially for secondary data, you can go on refining your research question and then be satisfied, okay, this is the question which I want to answer using my data. So are there any questions, Sumana?
Not yet, ma'am.
Okay. So for those who have joined late, we have just repeated some content from the previous presentation where we are really still looking at the research question, how we are identifying the research question,